I wanted to quickly take a minute to go over pediatric chiropractic, what that is, and our holistic approach to helping kiddos with ADHD, spectrum disorders, and sensory processing disorders at Verve. So at Verve Chiropractic, we are pediatric specialists. We also work with kiddos who are on the spectrum who are dealing with these unique sensory processing disorders, and we understand the challenges that your family's facing. We focus on the nervous system, so we understand specifically how the nervous system functions and how the relationship between the brain and the body can impact that sensory integration that really changes behavior and function of your child. We also have seen really incredible positive results with the kiddos in our office. We've seen kiddos gain speech, we've seen them emotionally regulate, we've seen them be able to be in school without outbursts and interact with their siblings. And we're really excited to share our results with you. So I want to take you back to why this type of neurological stress happens and causes these types of disorders. So what we understand as neurologically focused chiropractors is that the stress on the nervous system starts before babies are even conceived. The stress that mom and dad are going through in the prenatal period and the time during conception can lay the foundation for stress in our child's nervous system, which is frustrating, but it is just kind of the way it is. We know that mom shares a nervous system with babies, so what she experiences in that preconception time can impact the development of the nervous system. Additionally, the stress that mom experiences during her pregnancy can also impact the development of the child's nervous system. The same way that we share blood and nutrients with our babies, we share our neurological function. So our foundation, the state of our nervous system during our pregnancy can impact how our child grows and develops neurologically. After that prenatal or kind of preconception time, pregnancy time, we then get to birth. And birth is one of the single biggest traumas that babies go through initially in early life. Birth is beautiful, it's amazing, and it's also really hard. And so even in the most normal of deliveries or births, we can see significant stress, particularly on the delicate area between the head and the neck, where really important neurological components live. And so this can really disrupt the sensory information going to and from the brain, starting baby out with a state of stress. And so oftentimes what we see is that these babies are born with reflux, colic, they might have tension, difficulty breastfeeding. These are all early signs of stress in the nervous system. So what happens is that those babies grow and they develop and they adapt. So oftentimes what we think of as babies growing out of one condition tends to have them growing into another. So where we see our kiddos grow out of reflux, grow out of tension in their bodies, grow out of breastfeeding difficulties, well, we often see those kiddos then have constipation and they have sensitivity to sounds and they have all of these other things that then lead into the next thing, which lead into the next thing. And we're not surprised when we end up with a child who's struggling to respond to their environment because we've seen them respond ultimately from the day that they were born. And so oftentimes, not always, but oftentimes we see that our kiddos who are dealing with these ADHD, sensory processing and spectrum disorders, have histories that started with hard births, with mom experiencing stress during her pregnancy, and with these early struggles in life. So the nervous system is essentially at its core the brain, the superhighway from the brain down to the body, and that information coming from the body back up to the brain. It's a two-way communication pathway between the brain and the body that allows the body to do exactly what it's supposed to. And it's small, but you might be able to see here, the brain sends signals down the spinal cord out every single spinal level, talking to all these different systems in the body. The systems in the body then perceive the environment and send that sensory information back up the spinal cord and into the brain. And when that two-way communication works the way that it's supposed to, the body works the way that it's supposed to. But when we have disruption in that communication pathway, we see things not work the way they're supposed to, and that leads to symptoms. And more importantly for our purposes here, that leads to symptoms of sensory processing difficulty, which leads to behavioral output. Because when you think about it, garbage in equals garbage out in terms of information to and from the brain. Why would chiropractic help? Well, again, we are looking for where that stress is built up in the nervous system. We use very specific, gentle, age-appropriate chiropractic adjustments to help restore proper nerve function, to improve that communication from the body back up to the brain so the brain can perceive the environment better and send better signaling back out to the body. So using these very specific, gentle adjustments with repetition over time allows the brain to adapt to its environment better, and we see these kiddos completely change their function and their response to their environment better. So again, gentle chiropractic adjustments equal better regulation equals better output. So what to expect. When you come into our office, we're going to do a very thorough history with you. We're going to try to understand what happened before baby was ever conceived, what happened during your pregnancy, what happened during that birth process, and what life has looked like since birth. We then go in and do an objective evaluation using neurological scans. For our kiddos under 5, this includes a thermal scan that helps us detect where stress is built up in the nervous system, as well as heart rate variability, which looks at their ability to respond to stressors overall. Kiddos over 5 are also going to have EMG scans, which look at postural tone and essentially look at how hard the body is working to hold itself upright against gravity. And these 3 scans, along with your child's history, help us develop a very personalized care plan to help get them out of the state that they're in and into a state of calm and unwind. So the first goal that we have, like I said, is to calm and unwind the nervous system. We want to remove that stress, get them out of that fight or flight so that they can respond to their environment better. Typically, this phase starts with 2 to 3 visits per week in the beginning. Again, that depends on your child's scan and their history. We're using gentle, age-appropriate adjustments to help reduce the nervous system stress and improve overall function. Our goals are to reduce hyperactivity, anxiety, sensory overload, the things that your child is struggling with in the beginning. Sometimes this happens right away. Sometimes this takes a few weeks. So initially, what you should see in phase 1 is that your child is able to focus a little bit better. They have better behavioral responses. They're adapting to their environment better. We have calmed the nervous system. Phase 2, we transition into kind of the meat and potatoes of what we do at Verve, and that's really the restructuring and organizing phase, because we can essentially put out the fire in the nervous system, but if we leave any sort of smoldering ash, that fire is going to come right back. So at this phase, we're really cementing in all the work that we did in phase 1. We really want to make sure that we're helping that nervous system stay in this new pattern and that this is the permanent function moving forward. So we'll either remain at that frequency of 2 to 3 visits per week, but more often than not, we're reducing down 1 visit per week from phase 1. And so here we're continuing with those gentle adjustments. We're supporting nervous system function and making sure that sensory processing functions in the new pattern of that better processing. So during this phase, you should see continued sensory integration improved. We should see that they're able to process and respond to their environments better and that it lasts. We're seeing visit to visit that improvement that they've had is lasting. Most of our families are telling us during this phase that they see that behavior again lasting between visits. In phase 1, you might see better behavior in pockets. Here, we're starting to see that be their normal pattern. We're seeing the poor behavior typically as the less common function rather than the most common function. All right. And then once we're out of that cementing phase, we know that we have helped the nervous system shift over into a new pattern. We transition into wellness. For most of our families at the end of the corrective care, they're choosing to pursue wellness because they want to maintain the progress that they've made. So in this transition phase, we're dropping down our frequency because we just don't need as much at this point. The nervous system knows how to function in this new pattern. We typically see our patients once per week in transition. Once we get to this maintenance phase, we're just making sure that we're keeping all of the progress that we've made. We're doing regular check-ins, making sure that we're not losing any of that progress. If so, we can always reevaluate, reassess, and change direction. But typically here, we're just coasting. It's a really beautiful time where we've seen these long-term improvements last, and we know that we can back off with confidence in the frequency of care. What's really also exciting is that typically in this point, we're seeing better digestion, we're seeing better sleep, we're seeing better immune function, because when we improve the nervous system, we're not just improving that neurocognitive behavioral function, we're improving all systems in the body. So just to recap here, when you first come into our office, we're going to do our initial evaluation. That includes your initial history, the nervous system scans, as well as your child's first test adjustment. Once we get through this initial evaluation, we create that game plan for your child. We enter phase 1. It's 2 here, but we're really entering phase 1 at that point, which is the calm and unwind. We're taking your child's system out of that state of fight or flight and into a more rest, digest, and heal function. Then we transition into that restructure and organize. We make sure that the new neural pathways that we're creating are permanent. And once we've created that long-term change, we transition into wellness. Most of our families that end up transitioning into wellness are coming in anywhere from once a week to once a month, just maintaining that progress that they've made. So like I mentioned earlier, every child is going to have a very specific and unique care plan created for them based on their history and based on their scans. But the process in our office doesn't happen overnight because we are trying to permanently change the nervous system. You can expect the customized care plan made for your child to last anywhere from 2 months to potentially 6 months. Some of our families choose to get super bills. We will provide super bills, which is a medical receipt you can submit to your insurance, but it's not super common for insurance companies to reimburse for this type of condition. That being said, we're happy to provide that super bill so that you can see if you have coverage. If you have a PPO with out-of-network coverage, there's a possibility, but definitely ask our office for further details if this is something you're interested in. Initial visit will take the longest. It's about an hour in our office. That, again, gives us time to do all the things that we discussed previously. And follow up, the next appointment where we review the plan, takes about 20. But really moving forward, our appointments are super fast and efficient because we value your time. We know how busy life can be as a family, especially if you're doing OT and behavioral therapy and all of these other therapies that a lot of our kiddos are. And so we get you in and out of the office in 5 to 10 minutes. It's really, really efficient. And I think this is probably one of the biggest and most important questions, because how do you know that this will help? And really the best answer that I have for you is that A, the nervous system is predictable, and we know that if we remove stress, we can help your child improve in all areas. But B, we have a proven track record. We've seen huge benefits for kiddos who have these types of conditions. So one example I want to talk about is a 4-year-old that came into our office with mild autism spectrum disorder. He was nonverbal. He had been doing speech therapy for a year. And after just a few adjustments, he went from 0 words to speaking single words. Then it was 2 words. And now he's using multiple words at a time. He was the kiddo that didn't feel comfortable in social settings and wouldn't be out in the room when there were family gatherings. And now he's right in the center of everybody during family functions. He's cuddling with his sister. It's really been a beautiful and amazing change. We have another kid in the office that is 9, and this 9-year-old was really struggling in school because of his ADHD. Since he's been in our office, he's also been given a diagnosis of sensory processing and spectrum disorders, but he has gone from not being able to be in a classroom because of his outbursts to being able to sit through school, interact with his peers and his teachers. He's having less of those tantrums. He's interacting with the principal less because he's having better behavior overall. So really incredible things with the kids in our office. And we're happy to go over other cases and give you experiences and examples of kiddos who maybe are dealing with similar issues to yours. But we know that this can help make huge impacts, and we are just so excited to share it with you. So thank you for taking the time to listen to this. We're really excited to meet you in the office. If you have any questions before your appointment, feel free to reach out. Otherwise, we can go through it all when we see you.